Gentlemen, I need you to think about your breakfast today, or your lunch, or that snack you'll have later. I need you to think about it because there's a very good chance that hiding in that everyday meal is something I have to call a poison. It's not a dramatic label I use lightly. This particular substance, something you likely consume without a second thought, is quietly, steadily strangling one of the most important glands in your body. And for many men, by the time they feel the effects, we're already playing catch-up. I'm Dr. Catherine Rodger. Day in and day out, I sit with men just like you in my clinic. They come to me facing enlarged prostates that makes urination a constant struggle. They come with the persistent pain of prostatitis, and we have the serious conversations about early prostate cancer. The hardest part of my job is looking a good man in the eye, a man who's worked hard his whole life, and seeing the confusion and frustration when he realizes his body is failing him. And so often, I see that same look and hear the same question. Doctor, how did I not see this coming? Today, I'm here to make sure you see it coming. So please, stay with me. I'm going to show you exactly what this poison is, how it dismantles your prostate's health piece by piece, and I'm going to give you the straightforward steps to protect yourself. To understand the threat, you need to understand the hero it's attacking. Your prostate is a small, walnut-sized gland, but don't let its size fool you. It's the master control valve for your entire urinary system. It sits right below your bladder, cradling the tube that carries urine out of your body. When it works perfectly, you empty your bladder completely with a strong, steady flow. You sleep through the night. It also provides fluids that mix with sperm to form semen, directly impacting fertility and the health of any children you might father. But if this gland gets into trouble, it sends ripples through your entire life. It's not just about a weaker urine stream. It's waking up multiple times at night, exhausted before your day begins. It's that nagging sensation of needing to go even when you just went. It shakes your sexual performance. It can cause pain during ejaculation or contribute to difficulties with erections, undermining your confidence in the bedroom. Prostate problems are silent. It starts with whispers that are so easy to ignore, a stream that isn't quite as strong as it used to be, having to go just a little more often. We blame it on just getting older. Years pass. Then one day, the whispers become shouts. The nighttime trips become relentless. The stream becomes a frustrating trickle. For some, it culminates in a terrifying trip to the emergency room because they simply cannot urinate at all. That's when I meet them. I hear the same painful question every time. Doctor, how did I not notice? The answer breaks my heart every time. Because it's not their fault. The signs were subtle. And more importantly, no one ever connected the dots for them between the choices they make every single day at the dinner table and the health of this small, vital valve. That's why I'm talking to you right now. I'm handing the power to you. I've identified 4 major culprits, 4 common poisons that actively destroy the prostate. Now, your prostate today isn't the same as it was 30 years ago. Just like any part of us, it experiences wear and tear. Think of that master valve. After decades of faithful service, it becomes a little less flexible, a little more prone to stiffness. That's a natural process. But for 50, 60, 70 years, that prostate has been on the receiving end of everything you've eaten and every habit you've had. One scar means nothing, but a lifetime of them adds up. That accumulation is what often leads to a diagnosis of enlarged or inflamed prostate. The 2 major forces that create these scars are chronic inflammation and hormonal shifts. Think of inflammation as a slow, smoldering fire inside your body's tissues. Picture hormonal changes, like shifts in testosterone and estrogen balance, as a signal that tells your prostate cells to grow. These two forces are like twin hammers, constantly tapping away at your prostate. And this is the key. Anything in your daily life that feeds that inflammatory fire or throws those hormones further off balance is actively hammering at your prostate. So now let's identify the attackers. We're starting with poison number 4, and this one is crucial because it's not something you eat or drink. This poison is something you don't do. I'm talking about a sedentary life, sitting too much. You might be wondering, Doctor, what does my sitting around have to do with my prostate? The answer, in a word, everything. Your prostate depends on a strong, healthy flow of blood to work right and to stay healthy. Blood delivers oxygen and nutrients and carries away waste. When you move your body, when you walk, your heart pumps more robustly. That vigorous blood flow washes through your pelvic area, through the prostate, keeping everything nourished and clean. But when you sit for hours, that stream slows to a trickle. The blood pools and becomes sluggish in your lower body. Things get stagnant. When fluid sits stagnant in any system, it becomes irritated and swollen. For your prostate, this constant state of mild congestion from poor circulation is a direct irritant. It adds low-grade pressure and stress on the gland itself. Inactivity also opens the door for the prostate's worst indirect enemies. When you barely move, your body struggles to manage blood sugar properly. This leads to insulin resistance. Your cells start ignoring insulin's knocks, which is a fast track to type 2 diabetes. We know diabetes is a major risk factor for severe prostate and urinary issues. On top of that, inactivity makes it easy to gain weight. Extra weight, especially around your waist, isn't just a number on a scale. That fat tissue acts like a hormone factory. It converts your testosterone into estrogen. This hormonal shift, lower testosterone and higher estrogen, is a direct signal to your prostate that encourages growth. Every extra pound adds a little more pressure on that delicate valve, making it work harder. The solution? Get moving. Gently, but consistently. You don't need to train for a marathon or become a gym member. The goal is simply to break up those long sitting sessions and keep that blood moving. Start with small steps. If you sit a lot during the day, set a timer to remind you to stand up every hour. When it goes off, stand, stretch your arms, walk to the kitchen for a glass of water, or take a lap around the room. Next, build a daily walk into your routine. A 10-minute walk around the block is a perfect start. Next week, try for 15. Gradually build up to at least 30 minutes a day if you can. The pace should be enough that you can talk, but not sing. This regular movement improves your circulation, helps control blood sugar and weight, strengthens your heart, and yes, sends a healthy flow of blood to nourish your prostate. If mobility is an issue for you, you're not left out. Seated exercises are incredibly effective. While watching the news, lift your legs out straight, do arm circles, rotate your ankles. These small movements get the muscle pump going and fight back against that stagnant pooling. The rule is simple. Any movement is better than no movement. Consistency completely trumps intensity. A short workout every day is far better than one hard workout every month that leaves you sore. Think of each time you stand up as opening that valve just a little. Every step you take sends a fresh, clean wave through your pelvic region, soothing irritation and carrying away stress. It's a direct gift to your prostate, and it's a gift you can start giving yourself today. Moving on to poison number 3. The deception in your medicine cabinet. Harmless for the sniffles, harmful for your prostate. Those seemingly innocent pills or syrups you reach for a stuffy nose or itchy eyes. I'm talking about common cold and allergy medications. Names like Sudafed or Benadryl might ring a bell. We buy them without a prescription, so we assume they're completely safe. And for most of your body, occasional use is fine. But for a prostate that's already under pressure, these medications are a silent strangler. You see, these drugs work by doing very specific jobs. Decongestants, like pseudoephedrine, work by tightening blood vessels and drying out tissues. That's how they clear your sinuses. The problem is, they don't only work in your nose. They travel everywhere in your bloodstream. So they also tighten the muscles and tiny blood vessels around your bladder and prostate. Then you have antihistamines, like diphenhydramine. These calm down the body's allergy response, but they also tend to sedate or dull your nerves. This includes the nerves that tell your brain your bladder is full, and the nerves that trigger your bladder to squeeze. So while on an antihistamine, you might not feel the urge to go until your bladder is overstretched. Combine that with an enlarged prostate, and you've got a recipe for urinary retention, the bladder not fully emptying, or in worst cases, not emptying at all without help. Now, taking one of these for a day or two when you're miserably congested is usually okay. The real danger is the slow, chronic use. I've met men who take a daily allergy pill for months or use a nighttime cold and flu formula to help them sleep for a week straight. They don't connect their new difficulty urinating to the little pill they take. They just think their prostate is acting up. I've had a patient, an older, gentler man with mild prostate enlargement, who ended up in the emergency room during allergy season because his combination of decongestant pills caused his urinary system to shut down. He simply couldn't urinate. So what should you do? I'm not saying you must suffer through allergies or a cold. The key is to use these medications wisely and sparingly, especially if you already have any prostate issues. First, consider non-pill options. For a stuffy nose, something as simple as a warm saline nasal rinse or a steamy shower can clear congestion without tightening your bladder. For allergies, consider nasal corticosteroid sprays, which don't interfere with urination, or newer generation antihistamines that tend to have fewer side effects on the urinary system. Always ask your doctor which ones are safest for you. Second, be open with your doctor. Tell your doctor if you're relying on daily decongestants or antihistamines. There may be safer alternatives for you, especially if you have prostate enlargement. Also, be aware that a lot of multi-symptom cold and flu remedies hide these ingredients inside. That nighttime cold relief capsule might secretly contain a decongestant, a painkiller, and an antihistamine all in one. If you take a couple of those each day, you're effectively dosing yourself with things that squeeze and sedate your urinary tract without realizing it. Finally, if you do need to use these medications, use the smallest effective dose for the shortest time. Follow the instructions on the label exactly. Do not double up or take them longer than recommended. These pills are tools, not candies. Yes, they have their place, but using them daily without medical supervision is like playing Russian roulette with your bladder and prostate. Use them with respect and caution, and they'll serve you well when truly needed, without derailing your urinary health. Now, let's talk about poison number 2. This one is on your plate. I'm talking about the types of fats found in animal products, and even more importantly, processed meats. It's the butter on your toast, the cream in your coffee, the cheese in your sandwich, the marbling in your steak, and especially foods like bacon, sausage, hot dogs, and deli cold cuts. You might be thinking, I don't eat much red or processed meat, but the problem isn't just the obvious fatty steak or a couple of slices of bacon. It's the cumulative load of animal fat that finds its way into our diets from all directions. That frozen pizza, the canned soup, even that health chicken sandwich from a fast food place, they often contain more saturated fat than you'd guess. It's an invisible menace,
quietly upping your fat intake and, in turn, stoking the first of inflammation in your body. Here's exactly how these foods attack your prostate. They pour fuel on the fire of chronic inflammation. Eating a lot of saturated fat causes a direct increase in inflammatory chemicals throughout your body. This constant low-grade inflammation irritates all your tissues, including the delicate cells of your prostate gland. It keeps that slow burn going day after day. There's more. This way of eating is a primary driver of weight gain, particularly around the abdomen. As your waistline expands, it doesn't just put physical pressure on your bladder, but it also leads to hormonal shifts. Extra fat tissue converts your testosterone into estrogen, tipping the hormonal balance in a way that encourages the prostate to enlarge more. So how do we fight this hidden enemy? You become a label detective. Get into the habit of turning packages over and looking for saturated fat. A general goal is to stay under 20 grams of saturated fat per day. If you're dealing with active prostate inflammation or high cholesterol, aiming for even lower, say under 15 grams, is wise. So practically, this means rethinking some food choices. Cook more meals at home where you control what goes in, choose leaner cuts of meat and trim visible fat. Explore incorporating fish, which has healthier fats, or plant-based proteins like beans and lentils a few times a week. When you do buy processed items, a simple trick is to rinse canned meats like tuna or chicken underwater. This washes away a significant amount of added sodium and fats. You never have to eat bland food. Herbs and spices are your best friends. Garlic, onion, black pepper, rosemary, paprika, and cumin can make a simple piece of grilled chicken or a plate of roasted vegetables incredibly satisfying without needing heavy sauces or cheese. This change isn't about deprivation. After a few weeks of cutting down on heavy fats, your taste buds adjust. You might find that a fast food burger that used to tempt you now just tastes overly salty or greasy. Meanwhile, a home-cooked meal with fresh ingredients starts to become something you truly look forward to. And most importantly, your prostate will get some much-needed relief. By reducing these constant inflammation triggers and hormone-disrupting foods, you're actively essentially removing one of the big hammers pounding against it. This leads to fewer days of discomfort, or maybe any treatment you're undergoing for prostate issues starts working better. And beyond the prostate, your whole body benefits. Now we come to the number one worst poison, the sweet and deadly duo. It's everywhere, it's delicious, it's addictive, and we often equate it with comfort and reward. Ironically, it's one of the most harmful things we consume. I'm talking about sugar and its constant companion, refined carbohydrates. This includes the obvious spoonful of sugar in your coffee, but also the white bread, pastries, breakfast cereals, pasta, and sweetened drinks that so many of us enjoy daily. In my experience, this sweet sabotage is the major driving force behind the very conditions that end up hurting the prostate the most. Why is this a big deal? Because it doesn't just launch a single attack on your health, it launches a multi-front war. The first front is the path to metabolic disaster. Consuming a lot of sugar floods your bloodstream with glucose. Your pancreas releases insulin to manage that surge. Do this repeatedly, day after day, and your cells start to ignore the insulin. This is called insulin resistance, the main step towards type 2 diabetes. Eventually, if nothing changes, full-blown diabetes arrives, meaning chronically high blood sugar. High blood sugar damages blood vessels and nerves. The nerves that control your bladder and signal when you need to urinate can become impaired. I see men whose bladder function is so poor, they either don't feel the urge until it's an emergency, or they feel urgency all the time. The second front is inflammation. Every time your blood sugar spikes, it creates a burst of inflammatory chemicals in your body. If you're eating sugar throughout the day, you're keeping your body in a constant state of low-grade inflammation. This inflammation bathes your prostate in irritants, leading to swelling, pain, and aggravated symptoms.
The third front is hormonal chaos and weight gain. Your body stores excess sugar as fat, particularly around your abdomen. We've already discussed how belly fat converts testosterone to estrogen. But sugar spikes also increase a substance called insulin-like growth factor 1, or IGF-1. High levels of IGF-1 can act as a growth signal for prostate cells. As you can see, sugar and refined carbs hit from all sides. It's the ultimate enemy in disguise. That's why I call it poison number 1. Now, the good news. Once you recognize this enemy, you can fight back and win. First, learn to spot sugar on ingredient labels. It hides under names like sucrose, high fructose corn syrup, dextrose, and malt syrup. If it ends in ose or anything that obviously sounds like a sweetener, it's sugar. Your most impactful move is to eliminate liquid sugar. A single can of soda can contain about 10 teaspoons of sugar. Sweet teas, energy drinks, fancy coffee beverages, even many fruit juices are just as bad. Swap these for water, sparkling water with a squeeze of lemon, unsweetened tea, or black coffee. Even diet sodas, while they don't contain sugar, can keep your sweet tooth alive and kicking, so it's best to reduce those too if you can. Be wary of low-fat traps. To make up for lost flavor, manufacturers often add extra sugar. A fruit-flavored low-fat yogurt, for example, can have as much sugar as ice cream. Choose plain versions and add your own fresh fruit. Choose natural peanut butter, where the only ingredient is peanuts and maybe a little salt. Next, swap out refined grains for whole grains. Choose 100% whole grain bread, brown rice, quinoa, and oatmeal. The fiber in these whole foods slows the absorption of sugar, preventing those damaging spikes that fuel inflammation and fat storage. Make whole foods the foundation of your diet. Fill your plate with vegetables, lean proteins, and healthy fats. When you focus on real food, you naturally crowd out the processed sugars and carbs. Over time, as your body adapts to a low-sugar lifestyle, your cravings diminish. Breaking free from the grip of sugar and refined carbs is arguably the single most powerful act of self-defense you can do for your prostate. It's like removing the fuel from the fire and the bullets from the gun that have been aiming at your health. It requires effort, yes, but the rewards are a healthier, longer life. Now, I know this is a lot of information. Hearing the word poison can feel alarming. Please understand my intent isn't to scare you. My deepest goal is to empower you. Knowledge is your greatest tool. Prostate problems aren't a predetermined fate for every man. They're often the result of cumulative choices, and that means you have tremendous power to change the trajectory. You control whether you get up from the chair each hour. You decide when to talk to your doctor about your medications and see if there are better options. You choose what to buy at the grocery store. You pick the drink that goes into your glass. These are your decisions, and each one is a point of power. You don't need to overhaul your entire life by tomorrow. That path leads to frustration. I want you to think in terms of small, sustainable steps. What's one single thing you can do today? Maybe it's a 10-minute walk. Maybe it's reading the label on your bread. Maybe it's having water with dinner instead of soda. That one choice is a victory. That choice is a single solid brick in the protective wall you are building around your prostate. Consistency in these small choices creates lasting change. If this conversation has helped you, please share it. Many of them are walking through the same struggles quietly. Sharing it is a simple act of care that can make a profound difference in another man's life. If you'd like more guidance like this, I invite you to subscribe to the channel, like, and tap the notification bell. This helps you stay updated, and it helps me continue creating more content that serves you. Now, I truly want to hear from you. Tell me which poison surprised you the most. Tell me one small change you commit to starting with. Your comments help others feel less alone,
and I read them because they guide me on what you need next. Thank you for trusting me with your time today. Thank you for caring about your health. Your prostate works tirelessly around the clock. It's time we give it the conscious care and respect it deserves. I'm Dr. Catherine Rotker, and it's been a pleasure guiding you through this. I wish you a long, healthy, and vibrant life. Take care of your prostate, and you take care of your life. I'll see you in the next video.